Puerto Rico Medical Board style clinical vignettes. Topic: VQ mismatch, increased or decreased in pulmonary pathologies. Clinical vignette number 1, pulmonary embolism, increased VQ. A 45-year-old woman with a history of recent long-haul travel presents with sudden onset shortness of breath and pleuritic chest pain. Her respiratory rate is 26 breaths min, heart rate 112 BPM, and oxygen saturation is 89% on room air. D-dimer is elevated. A ventilation perfusion VQ scan shows normal ventilation but absent perfusion in the right lower lobe. Question: which of the following best describes the VQ ratio in the affected lung area? A. Decreased VQ ratio. B. Increased VQ ratio. C. Normal VQ ratio. D. Zero VQ ratio. Correct answer B. Explanation: in pulmonary embolism, blood flow is blocked Q, while ventilation remains normal, leading to an increased VQ ratio or physiologic dead space. Clinical vignette number 2. Right to left shunt, decreased VQ or zero. A newborn develops cyanosis shortly after birth. Oxygen administration does not improve the saturation. Echocardiogram reveals a ventricular septal defect with overriding aorta and pulmonary stenosis, confirming tetralogy of Fallot. Question: what best describes the VQ ratio in the areas of the lung affected by the shunt? A. Increased VQ ratio. B. Decreased VQ ratio. C. Zero VQ ratio. D. Infinity VQ ratio. Zero VQ ratio. In a right-to-left shunt, blood bypasses ventilated alveoli altogether, no ventilation, resulting in a VQ equals 0, perfusion without ventilation, known as a shunt. Clinical vignette 3. COPD, chronic bronchitis and emphysema. A 60-year-old man with a 40-pack year smoking history presents with progressive dyspnea and chronic productive cough. On physical exam, there are wheezes and decreased breath sounds. ABG reveals hypoxemia and hypercapnia. Question: what VQ abnormality is most characteristic of his lung condition? A. Uniform VQ ratio throughout lungs. B. Increased VQ ratio in all lung zones. C. Mixed high and low VQ ratios. D. Normal ventilation with reduced perfusion. Correct answer C. Mixed high and low VQ ratio. Explanation: in COPD, some alveoli are poorly ventilated, others are overinflated but underperfused. This leads to areas of low VQ and high VQ, creating a mismatch and impaired gas exchange. Let me know if you'd like flashcards, summary tables, or